Yeah, 4 minutes to spare. It is efficiency. I am a trade unionist. I have been in the public service for most of my career, but I have done the private sector as well. So the discourse that we hear all the time about the private sector being able to deliver services more effectively, I take issue with that, and I won't go into that too much. But I will talk to you about the Canadian system. And as I was speaking to Steve, he said that it might be a good idea if we just did a little history lesson here, so that you could know how Canada came to get a single-payer system. It's called publicly funded healthcare. It started in the province of Saskatchewan way back. We go to about 1947. What happened was, back in the 30s, Saskatchewan, which is located just north of North Dakota, and it's a prairie province, Dust Bowl, bad times in the 1930s. It led to misery, and the people there were ripe for what you called people policies, socialism. So you had a young firebrand minister-type politician by the name of Tommy Douglas. And Tommy Douglas is a great Canadian. He was named a great Canadian a few years back. And Tommy Douglas really worked for the people, the farming people of Saskatchewan. And the CCF party, which was the Commonwealth Confederation, was a party that really worked with the grassroots. And so he proposed for Saskatchewan a hospital insurance plan, which was kind of revolutionary back then. And he came up against a lot of opposition. But he managed to get through. And the biggest opposition that he ran up against in getting a national, a provincial health insurance, hospital insurance plan through was the doctors themselves. And that's something that you are actually experiencing right now as well. But he fought for it. And he fought so much for it that finally it was passed. And the Saskatchewan health insurance model was so inspiring across the country that it took about 10 years, but finally it was proposed at the national level. Now, Paul Martin Sr., who is the father of Paul Martin Jr., who was our Prime Minister up until a few years ago, actually tabled the National Health Care Plan. And the Canadian Medical Association at that time was the biggest opponent to publicly funded health care. After that, a royal commission that was headed by Dr. Emmett Hall. Now, a royal commission in Canada is a government-appointed panel of eminent specialists, people who are specialists in the field. They come together and they do an inquiry, they investigate the issues, and the Royal Commission came out and said that they needed publicly funded health care in Canada. So finally in 1966, Parliament passed the National Health Care Act. Now, it's important to state at this point, especially where we are here down in the United States, that it probably wouldn't have worked if it had been all the provinces individually going ahead and doing their own healthcare program. What happened was that Saskatchewan was it was a socialist province, the most socialist province in Canada back in the 40s and the 50s. And they went progressively with it. It caught on. But it had to be enacted nationally, across the country, in order for it to really take root. So I'm going to just talk about a personal situation. It's a situation where my partner's brother, just to give you an example of how powerful it is, we all have the stories about what people go through when disease strikes indiscriminately. A young man, 42 years old, married, 2 kids, doing everything right, doesn't smoke, doesn't drink, cycles, and all of a sudden something's not going right, and they discover that he has cancer in his liver. Now, most of you probably know that when you're diagnosed with cancer in the liver, the tumor, it doesn't mean that, you know, it started there. It usually means that you have it somewhere else in your body, and it's manifesting itself in the liver. So they took out the tumor, and approximately 6 months after the operation, it was back. And it was back in a quite aggressive form. So the doctors decided that he needed a transplant. So he'd had about 6 months. That's what they thought at the time. This is about 3, almost 4 years ago. So they found one. It was what you call a second-tier donor, which means that this person, in this case, had cancer before but was free for 20 years. They found a second-tier donor, and he got the transplant. About a week after the transplant, the body rejected the liver. And he had about a week in which they needed to find a liver. And it was almost miraculous, but on the 5th day, they found a donor, and it was a first-tier donor. So now we've got 2 transplants. The second transplant, it worked. The body accepted, and so far so good. However, there was problems with the stem, with the bile duct. There were complications because the cancer had started to metastasize into the intestines. He needed surgical procedures. Just for the stent alone, they had to go in 10 different times over approximately 3 to 4 months to get the stent correct. The intestine, probably about 5 or 6 surgical procedures. There were procedures for corrective. He needed angioplasty. And to make a long story short, the amount of procedures, the amount of intervention that was required is almost mind-boggling. It got to the point where he was practically a walking experiment, because after a while, you can sign a waiver, and the waiver is basically, you're going to be part of a study, and we're going to try things with you that perhaps we can't give guarantees. But then again, when hope is the only thing that's left, you sign and you participate. Now, somebody will say, isn't there a point at which we stop? Isn't there a point at which we say, enough is enough? And that's the question that you have to ask. Originally, he had maybe 6 to 12 months. 2 young kids, age 2 and 4 at the time. One last Christmas is what the doctors said. One last Christmas turned into, well, one last summer vacation in Cape Cod. And then it turned into a second last Christmas. And then a second last summer vacation. And now it's been 3 Christmases, and it's been 3 summer vacations. And the kids are now 7 and 5. And they've had their father longer than expected.